Good morning, I'm Sunetra Choudhury, political editor of the Hindustan Times, bringing you all that you need to know about COVID-19 on Wednesday, the 26th of August. First up, a look at the numbers. In just the last 24 hours, we've seen 66,781 new cases across the country. We've also seen 1,066 deaths, which brings us to our top story. Are we now seeing the coronavirus across India move from the urban to the rural areas? Well, the data certainly seems to suggest that. While in April, 64% of the cases were from urban areas, now that figure has reduced to 29%. In fact, more than half of the cases of the coronavirus are now being classified as from districts which are mostly rural. Delhi, Mumbai, Chennai initially, especially in April and June, had about 40% of the cases in total. Now they are just about 5%. So these big centers of infection are now no longer so. Now the bad news is that most of the districts across the country are now infected. Remember, in March and April, at that time, we said that there were huge chunks of the districts in the country, of the 734 districts in the country, which were still untouched. Now there hardly seem to be any that are untouched because more than 700 are now impacted by the virus. And the worrying thing is that Bihar and Uttar Pradesh are the ones which are seeing bulk of the cases, and they are also testing lower than the national average. The next story that we have is that while we're saying that the infection is moving away from urban areas, but it seems that Delhi may be seeing a resurgence of infection, at least a spike. In fact, in the last particular week, we are seeing cases go above 1,500 every single day. Average number of cases has been 1,300, and this is much more than the average 900 cases that we were seeing in the first week of August. Of course, it's a long way off from the highs that we were seeing in June, which were above 3,000. But what authorities are worried about is the fact that the metro is now going to open. It's been given the green signal. So are we going to see a resurgence yet again? And that's why all of us have to be especially careful now and perhaps maintain social distancing, wear a mask, not go out if we can avoid it. When we speak of reinfection, of course, the case that everyone across the world is talking about is the Hong Kong case and the person who has been reinfected. Scientists now all looking at it, and what they say is that the case occurred, how they explain it, is that the antibodies that had been generated from the first infection way back months ago, is that those antibodies would have tapered off, which is why the reinfection occurred. Now, they say this has implications. The big picture from all of this and what we can learn is that, one, you have to actually depend on vaccine and not herd immunity to protect us from the coronavirus. And the second thing is that perhaps those who have recovered from the virus also need to be vaccinated, otherwise reinfection can occur. Of course, a lot of experts also pointing out that this particular case from Hong Kong, among the millions of cases that we are seeing worldwide, is the exception that proves the rule. Now, if many of us are worried about the fact that we haven't been able to go out, we haven't been able to renew documents like our driving licenses, we don't have to worry anymore. The Ministry of Transport has said that they can be extended, and places like Delhi have extended it till the 31st of December. So that because they are not able to give the number of driving tests to as many people because of COVID restrictions. However, this kind of relief doesn't impact the pollution certificate. So if you are driving around, make sure that your pollution certificate is up to date. And finally, it's good to talk about vaccines because they're a source of hope. And India is now in talks with Russia for its vaccine. Russia has said that they're the first to have a ready vaccine, although they're yet to do human trials on a large scale. Sputnik 5, Delhi has been sent some initial information about it, and Health Ministry officials confirmed that they are in touch. Meanwhile, the trials for the Oxford vaccine have also begun in Pune, because that's where the Serum Institute of India is, which is tied up with the Oxford vaccine. Those are the news updates for now. Keep tracking them on HindustanTimes.com.